We've all had those moments. I'm getting more and more of these as I get older and older. You forget your car keys, maybe you blank out on somebody's name. When you get to a certain age, it starts to concern you. Is this just what we refer to as a senior moment, or perhaps an early sign of Alzheimer's? There are literally millions of people affected by Alzheimer's or related dementia, and that is why the research being done on this disease is so important. Dr. David Carr is the medical director at Parc Provence and professor of medicine and neurology at WashU. He's here to tell us about some of the things they're doing to help those affected by Alzheimer's and dementia. Thank you for coming in, Dr. Carr. Appreciate you being here very much.
Kent, glad to be here.
Can you very quickly tell us what is the difference, if any, between dementia and Alzheimer's?
So great question. We're asked this a lot. Think of dementia as a syndrome, a group of diseases like arthritis. If you think about the term arthritis, there are specific causes of arthritis: lupus, degenerative joint disease. Dementia is the same. You can have medications that can cause memory problems, strokes. Alzheimer's disease is one of the causes.
Okay, so dementia is a broader term.
Correct.
Okay, but we're seeing more and more, because of our aging population and better diagnosis now, we're seeing more and more Alzheimer's-related dementia than in the past.
You hit the nail on the head. We have 5 million people in this country with Alzheimer's disease or related disorders. By mid-century, 15 million. By the time you get to age 85, you can almost flip a coin. About 50% of people have the disease.
Wow. We're hearing more and more discussion and breakthroughs and research being done with identifying those who are at risk before they're diagnosed, perhaps, genetic signatures, things like that, but also things that we can do as we reach this middle age and older that will keep our mind more active. But the reality is, people are going to go undiagnosed until it's too late, until they're symptomatic, and then it's too late for some of those things that we could have done to avoid it. But there are better things that we can do now that help people that have already been diagnosed to help make progress and improve lifestyle. Correct?
I believe that's the case. Although nothing's been proven, this whole issue of prevention comes up all the time in our clinics. So what can you do or a family member do to reduce your risk? Exercise appears to be a healthy lifestyle behavior that's been associated with a prospective decreased risk of Alzheimer's disease. Healthy nutrition, fruits, vegetables, oily fish, a serving or two a week. Staying active, cognitive stimulation, social connectiveness. These are probably going to be the keys from an environmental standpoint to decrease the disease.
And families are really important in that network of all of those things that you talked about.
Where they're critical. And in fact, when you've lost a spouse and you're starting to dement and you're living by yourselves, getting into an environment's critical. A lot of people try to hold on and live independently. And it can cause a lot of stress when people are admitted to state-of-the-art dementia facility like a Parc Provence or similar facility. They can have that environment that supports them from both a cognitive, physical activity, socialization standpoint, help stabilize and improve functional and quality of life.
So think about that for a moment. The longer you wait, the more harm you can do. I mean, I know that people can be very stubborn when we start talking to them about, we need to get you in a facility where people can take better care of you and help prolong your lifestyle and improve the lifestyle as we move forward from here. And that's a hard discussion to have.
It's a very difficult discussion to have, and about 50% of our Alzheimer's patients lack insight. And really, it's going to take the family working with them and just taking that step to make the move. But 99% of the time when the move's made, it's a positive thing for everybody.
Yeah, for everybody.
Yes.
That's important to point out, too. WashU has really been a driving force in the research that's being done.
Oh, it's huge. The Night ADRC is one of our top Alzheimer's programs in the country, not only just based on cutting-edge research, but dollars in different research studies. One of the exciting studies we have now is actually treating people before they have symptoms, looking at the anti-amyloid or anti-protein therapies that will decrease the amount of amyloid that's in the brain and hopefully delay the onset of the disease before people even get symptoms.
So these are people, like we talked about earlier, that that are pre-genetically disposed to a likelihood of suffering from Alzheimer's down the road?
Right. So the trials are enrolling people who have an increased susceptibility due to genetic factors or due to environmental factors. But we can diagnose the brain changes of Alzheimer's disease now before people have symptoms by our PET scans and our lumbar puncture tests.
Now, it's really important to get the right kind of care and to put your loved one in a place that really specializes in this particular ailment, in Alzheimer's, because that's what we're talking about here, is all that special need that they have. Parc Provence is located in Creve Coeur. For more information or to schedule a tour, give you a free tour, it's a beautiful place, call 314-542-2500 or visit parcprovence.com. Thank you, Doctor.
You're very welcome.